So now we start with another topic, that is accommodation. So in our last video we had talked about the anatomy of the middle layer, and in that middle layer of the eye that we had talked about the ciliary body. When we were talking about the ciliary body's anatomy, we also talked about the functions of the ciliary body. We said that one of the major functions of the ciliary body is accommodation. Now what exactly is accommodation? Accommodation is actually, let me first get a few statements out of the way and then I'll be explaining them in detail. So accommodation is a part of something called the near reflex. Now what exactly is the near reflex? See, our eyes behave differently when we're looking at something at a far distance and when we're looking at something close to us. So this is because varying distances affect our eyes differently. So for example, let me be more clearer. If this is suppose a lens, right? We know some elementary grade of physics, right? We have talked about, or rather we have learned about optics, I would assume. So we know that when light rays are traveling from a very far away object, they tend to be parallel to each other, right? Now, when these parallel light rays travel and when they fall upon a converging lens as is present in our eye, they are converged at a particular point on the retina. This is the retina. Now, this point, converging image or converging light rays fall on the retina, which is the neurosensory part of the eye, and hence an image is formed in our brain. Okay, so this happens when the object is very far away. But what about when the object is pretty close? If the object is pretty close, then the light rays traveling from the object will not be parallel to each other. They will not act as if they are coming from infinity. Rather, suppose this is the object, it will be somewhat diverging, right? Suppose these are the light rays. I'm just taking two light rays here. So now the lens in our eye, or rather the converging system in our eye, needs to act a little differently. It needs to act a little differently. Why? Because the retina's position in the eye is fixed. This is the retina, right? You cannot alter the position of the retina. That's a fixed layer. You also cannot alter the distance between the lens and the retina that much, because our eyes are they're not squishable objects. We cannot just change the shape and size of our eyes as we please, as is shown in many cartoon shows. Real life isn't cartoon, unfortunately. So what happens is, by hook or crook, our eyes need to, or rather our lens needs to, converge light rays onto the retina. When the light rays are coming from infinity, this is what happens. But what about when they're not coming from infinity, or rather when they're not coming from an object very far away, they're coming from a closer object? Then the light rays would be somewhat diverging, and then again, to converge the light rays onto a single point on the retina so as to form a proper image of that object on the retina, what needs to happen? Our lens, or rather the converging system in our eyes, needs to undergo some kind of a change. It cannot be the same, right? These two situations that I've just explained, these two situations are not the same. So obviously our eyes need to act differently in each case. I'm just giving you the crux. I will obviously be talking about this in a lot more detail in this video. That is what this video is going to be about. But I'm just talking to you about why we need to have different scenarios, or rather why our eyes need to act differently for different objects, or rather for objects placed at different distances from our eyes, right? That is why for viewing objects which are close to us, this is the close object and this is the far away object. For viewing objects close to us, our eyes undergo what we call to be the near reflex. The near reflex. So near reflex is basically what? Near reflex is termed as the collection of changes that occur in the converging system of our eyes to focus the light rays from an object which is comparatively close to us. Okay, so when looking at a near object, the set of changes that our eyes or the converging system of the eyes has to go through to converge those light rays at the retina is called near reflex. So that in a nutshell is what near reflex is. Near reflex is basically what our eyes need to do for near objects, objects which are located close to us. Okay, for seeing them, our eyes need to do certain things, or the converging system of the eyes need to do certain things, that is near reflex. Okay, done. Now what exactly is the near reflex as far as its constituents are concerned? Like, what exactly does the eye do to bring about this change? We saw what the change is, we saw what is at stake here, but what exactly, or rather how exactly does our eye achieve this? That is going to be the crux of this video. Now near reflex is basically, if I can put in another slide over here, near reflex is constituted by three things. First is convergence, second is meiosis, and third is the topic of our discussion today, accommodation. Okay, so basically accommodation is a part of the near reflex, which I had just mentioned when we started this video. What exactly do these terms mean? Let's explain them in a little bit more detail. When we are looking at something, this you can try just right now. Suppose you're looking at the far away point, suppose you're looking at the door in the room that you're sitting in, which is pretty far away from you, I'm hoping. Or let's just like take any example in your room, something that is far away from your eyes. Look at that. Now try to put your pen or pencil, whatever you have, and stick it right in front of your eyes, and now try to look at that pen. Okay, do you understand what just happened? Your eyes, if I can draw them, suppose these were your eyes when you were looking at the door. Okay, but when you were looking at, suppose, the pen, your eyes went like this. This is the pen, suppose. This is the pen. You're holding this. So when you're looking at something which is close to you, did you see what happened to your eyeballs? They moved towards the midline. That is, they converged. So convergence is a part of the near reflex because it is a part of the change that occurs in our eyes when we are looking at a nearby object. Did you understand? Suppose you're looking at a faraway object. This is when you're looking at a faraway object. Okay, normally this is how your eyes are. But when you're looking at something near you, suppose like this is a pen, this is an object, whatever it is, you're holding it pretty close to your eyes, then you try to look at it, you will see that your eyes are converging, or rather they're shifting towards the midline, they're moving medially, your eyeballs are moving medially, right? They're rotating medially, they're converging towards each other. That is what convergence is. So convergence is a part of the near reflex. Done. Another thing that happens is, if you look very closely, we had talked about the pupils, right? So if I draw, suppose, another image here, right? Suppose this over here. Okay. So let's suppose this over here is the iris. The blue colored part is the iris. And that black hole in the center. So suppose this entire blue thing is the iris. Okay. And that black portion in the center, that is your pupil. Okay. So what happens, another thing that happens is when you're looking at a nearby object as a part of the near reflex is your pupils constrict, as is evident from this picture. So suppose your eyes before you were looking, they were somewhat like this. Okay, big. you have big pupils here in this image. Suppose I'm like drawing very roughly here. These are not at all good images, but I hope I can carry across the point that I'm trying to put forward here. So suppose this over here, the pupil is pretty big. The pupil is the black part over here, the black middle part within the iris. The iris is the blue part over here. So suppose in the first image, the pupil size is pretty big. That is when you're looking at a far away object. But when you're looking at a closer object, your pupils are constricting to restrict the light rays traveling from other objects, traveling from the entirety of the room. Suppose you're sitting at a room and you're trying to look at the pen or the pencil that you're holding right in front of your eyes. So what will your eyes try to do? Your eyes will try to restrict the light rays coming from every other part of the room, so that you can focus only on the object that you're holding, that you're trying to focus on. So that is why meiosis and mydriasis, I think I had explained these terms in my previous video as well. Meiosis means basically constriction of the pupil, and mydriasis means dilatation of the pupil. So meiosis means constriction of the pupil is something that happens as a part of the near reflex. Okay, done. So we have talked about two things that happen. First is convergence, your eyeballs move medially, and second is meiosis, that is your pupils constrict as a part of the near reflex, and third is accommodation. Now what exactly is accommodation? See, it's very simple, very simple. I have drawn two images over here. Now first let's label these images very quickly. Since we have already talked about the anatomy, this should be very easy. So this over here, these are the ciliary muscle. We have talked about the anatomy of the middle layer of the eye, so this should not come as a surprise as to what these parts are. This over here is a ciliary muscle. Same, this over here is also the ciliary muscle. Okay. Now, what these thread-like structures are, these green thread-like structures from the ciliary muscle, what are they? We already know what they are. They are ciliary zonules. Ciliary zonules. What is this blue structure? We know this as well. This is the lens. A over here means this is the anterior surface of the lens, and P over here means this is the posterior surface of the lens. So basically the light rays are coming from the anterior side, and posterior side is facing which part of the eye? Yes, posterior part is facing the vitreous chamber in the eye. We have already talked about the anatomy of the eye somewhat, so we know all these things. Similarly, over here, this is the ciliary zonules, and this over here is the lens. Now, what exactly is accommodation? We already know that accommodation has something to do with looking at nearby objects. What exactly is that? For understanding what accommodation is, the first thing that you need to understand is why we need accommodation. Before understanding what, we need to understand the why. See, let's go back to that first image that we had drawn when we first started this video. I had said that when a faraway object, the light rays are coming parallel to each other, almost parallel to each other, whereas an object close, the light rays are diverging. So now think and tell me, this is elementary optics. Light rays parallel to each other, the power of the lens that is needed to converge them, would it be the same power needed by the lens to converge light rays in the second scenario, where they are actually diverging from each other? In which scenario do you think the lens would require more power? The first instance or the second instance? Obviously, the lens would require more power in the second instance. Why? Because in this instance, the light rays are diverging from each other. They are actually not parallel to each other, they are diverging. So something which is already diverging, you need to converge them. So you need more power. Whereas in the first scenario, the light rays are parallel to each other, so they're not diverging from each other. They're not converging either, but they're not diverging either. So at least they're not diverging. So you won't need as much power to converge those light rays as you need in the second scenario, which is when the object is close to our eyes. Okay, so basically what I'm trying to explain over here is the fact that the power of the lens needs to change. Now that we have established the fact that power of the lens needs to change to focus objects at different distances onto the retina, now we need to understand the very fact that we have learned something in our physics days. What is that? Power is actually 1 by focal length, or it is inversely proportional to the focal length. What does this mean? This means that more the focal length, lesser the power. Let's make this easier, or rather simpler. Suppose, let me make another slide over here. Suppose this over here is the lens. Okay, look at the curvature of the lens surface. Okay, it is somewhat flat. Now this is another lens. Look at the curvature of this lens. This is the first lens, this is the second lens. The curvature of the first lens is less, right? It is not as curvy as the second lens, right? Understood? So if the radius of curvature of the first lens, which one would be more? The first lens's radius of curvature or the second lens's radius of curvature? Obviously the first lens. Why? Because think about it. If we were to complete the circle, suppose, like, this is all elementary optics, that is why I'm going into so much detail, okay, so that we leave no stone unturned. We form a circle for both these lenses, right? This is how we define radius of curvature of a lens, right? That it is the radius of the circle that is formed by the surface of the lens. So this over here is the radius of curvature of this lens. Whereas if we were to complete this circle, which is more curved in the second lens, then this circle is a lot smaller. So then let me use a different over here. So suppose this over here is the radius of curvature. So R1 is greater than R2. Okay. Now we know that R1, the radius of curvature of the first lens, is greater than that of the second lens. But that also means that the power or the converging power of the first lens will be smaller than that of the second lens, right? It will be smaller because the focal length of the first lens will be lesser than that of the second lens. So let me go back over here, f1, right, it will be greater than f2. The focal length of the first lens will be greater than that of the second lens. Now we already know that the power of a lens is inversely proportional to the focal length. So P2 will be greater than P1. If you did not get this entire thing, then let me just make this very clear with just a single statement. The more curved the lens is, obviously the converging power of that lens will be more. Suppose this is a flatter surface, the converging power of this will be lesser, whereas this is a more curved surface, so the converging power is more. This is the first case, this is the second case. So what I'm trying to say is, the more curved the anterior surface of the lens, the more curved the anterior surface of the lens, the more its converging power. That is all I want to. If you did not get all this radius of curvature, focal length, and all this thing, the only thing you need to get across your brains right now from a medical perspective is when the anterior surface of the lens is more curved, it has more converging power, which means when the light rays are traveling from infinity or from a faraway object, we would want the surface of the lens to be flatter, or rather the anterior surface of the lens to be flatter. Whereas when the light rays are traveling from closer distances, we would want the anterior surface of the lens to be curvier. That is all. That is all. Okay, that is all that I wanted to convey through all this 5 or 10 minutes of whatever I have concocted over here. Okay, now to change this curvature, of the lens, or the anterior curvature of the lens, some things need to happen. These things that happen, the power of the lens changing to accommodate for varying distances of objects and focus them on the retina, this is what accommodation is. So basically accommodation is what? Our lens accommodating for the varying distances. How? By changing its power. How does it change its power? By changing the curvature of the lens. How does it change the curvature of the lens? This is what we will explain now. That is why we have these two somewhat good diagrams. See, in the first instance, what is going on? See, in the first instance, the thing that we immediately notice is the anterior surface of the lens is flat. Anterior surface of the lens is flat. Now think about this. How will you make something flat? By pulling it, right? How do you stretch something out? How do you make something flatter? By pulling it. So to pull the anterior surface of the lens, who exactly will be pulling it? It will be pulled by the ciliary zonules. So if the ciliary zonules have to pull the lens in opposite directions, the ciliary zonules will pull the lens in opposite directions and hence make it taut, tight, and hence the anterior surface of the lens will become flat. That is what we want to achieve in this first scenario over here. So to achieve that, what do the ciliary zonules need to be, or how do the ciliary zonules need to be? The ciliary zonules need to be stretched. They need to be stretched or tense. Ciliary zonules need to be stretched or tense. Now, understand another thing. What are the ciliary zonules attached to? The ciliary zonules are attached to a muscle. That is the ciliary muscle on both sides, here and here. Now, the important fact that you need to understand about muscles, let's take a very quick new slide and explain this. A muscle can either contract or a muscle can relax. What happens when a muscle contracts? When a muscle contracts, suppose this is the spindle of the muscle, it will bulge up like this. Whereas when it relaxes, if this is the muscle spindle, then it flattens like this, right? So what I mean to say is, when a muscle contracts, it will pull two objects closer. For example, suppose this is the biceps, this is your forearm. When you contract your biceps, what happens? You flex your forearm, right? Whereas when a muscle relaxes, it pushes two objects further away. So just like this, when you're relaxing your biceps, you're actually straightening out your forearm like this. This is the relaxed biceps. So now, for contraction, the muscle will pull two objects together, whereas when the muscle is relaxed, it will push two objects further away. Think about this and now try to understand how will the ciliary zonules, which are now taut and stretched, how will the ciliary muscle react to that? Or rather, how will the ciliary muscle ensure that these ciliary zonules are taut? For ensuring that, the ciliary muscles need to move in this direction. How can they move in opposite direction? If they push each other apart, that is, if they relax. Think about it, again think about it. If the ciliary muscles had contracted, then they would have pulled towards this side, they would have moved towards this side. Then what would have happened? Then the second scenario would have happened. That is, the ciliary zonules would have become loose, they would have become relaxed. The ciliary zonules would have become relaxed, but the ciliary muscles would have contracted. That is not what we are talking about right now. Right now what we are talking about is the first scenario. The ciliary muscle has to relax. So, what are the three things that have happened over here? First thing is, let me put another ink over here. Yeah. First thing, the anterior surface of the lens became flat. Second thing, the ciliary zonules were stretched. And third thing, the ciliary muscle relaxed. These are the three things that happened. As a result of these three things, what will happen is the light rays that are traveling from, suppose, infinity or from a very far away object, now they will be focused on the retina. So this first scenario is basically what happens when light rays are traveling from infinity or from a very far object. This is the scenario that happens in our lens. What are they? The anterior surface of the lens becomes flat. How? By the ciliary zonules being stretched or tense and the ciliary muscles relaxing. Thus, the lens's anterior curvature, what will happen to that? It will become flatter, and hence the parallel rays of light, they are converged by the lens on the retina. But suppose if it was the second scenario, that is, the light rays are not traveling from infinity or from a very far away object, but rather from a somewhat shorter distance, then they would have been somewhat diverging light rays, and then the lens would require more converging power. And how will the lens acquire more converging power? By increasing its curvature, as is evident from this picture over here. We can already see that the anterior surface of the lens is more curved. Anterior surface of the lens is more curved. And how was this achieved? How exactly was the anterior surface of the lens more curved? Think about it again. For making it more curved, the ciliary zonules need to push. That is, the ciliary zonules need to be relaxed. So the ciliary zonules relax. And how can the ciliary zonules relax? When the ciliary muscle is contracting. Because now think about it, if the ciliary muscle is actually pushing like this, then what will happen? If the ciliary muscle is contracting in this way, then the ciliary zonules will relax. Think about it. If you have to make a rope taut, then what do? You pull it from both ends. But if you want to make the rope loose or relax the rope, then what do? You push the rope on both ends. So suppose this is a rope. For making it taut, you pull. But for making it, loose, what do? You push the rope on both ends, and somewhat this happens. A loop forms over here, right? This is a normal simple rope. Think about it. This is all depending, this entire video and the concepts that I'm trying to get across to you in this video all depend on how well you think. That is all. And I'm trying my really hard to convey the concepts that need to be understood in this video. So the opposite things happen in the second case. Okay, so the anterior posterior diameter of the lens, the AP diameter of the lens, that will increase in this case. Why? Because the lens is more curved, or the anterior surface of the lens is more curved. But the posterior surface of the lens in both cases does not change much. So there is no change in the posterior curvature of the lens, only the anterior curvature of the lens changes. Okay, so now what will happen? Now what will happen is, if suppose these are the light rays and they travel like this, then because of the increased curvature, they will be focused on the retina. Okay, just like I had explained in the previous slide. This, in a nutshell, is accommodation. So these changes that the lens and the ciliary muscle and the ciliary zonules that are taking place, this is basically what accommodation is. Okay. Now, this is what happens in a normal physiological eye. But what happens if there is some kind of an anomaly in this accommodation? The two anomalies that we need to understand in this scenario, the first one, very, very important, is called presbyopia. Presbyopia. These are anomalies of accommodation. Anomalies of accommodation basically means when accommodation is not occurring the way that it should. Okay. So what exactly is presbyopia? Presbyopia is basically insufficiency of accommodation. Insufficiency of accommodation. So if accommodation is insufficient, then you will not be able to look at nearby objects, or rather the converging system of your lens is not that good. So what will happen is you'll have a harder time having good images of nearby objects, of objects which are closer to you. Okay, so basically near vision is affected. Okay, now the interesting thing about presbyopia is almost everyone is affected by presbyopia after a certain age, that certain age being greater than 40 years. So above 40 years, almost everyone has to get spectacles. The reason for that many times is the accommodation system in our eyes often stiffen up. They don't work the way that they should, and hence we have a harder time looking at nearby objects. So near vision is affected, and that is what presbyopia is. So how exactly are we going to treat? Obviously, we are going to treat presbyopia by correcting the converging system. And how exactly are we going to correct the converging system of our eyes? Surgery. Well, surgery may be an option, but not the first option. Otherwise, every eye problem would have had to be dealt with a surgery. The first and the most viable option that we have for treating presbyopia is basically spectacles or glasses. So we need spectacles. Why do we need spectacles? Think about it. Our eyes have a hard time, or rather in presbyopia, our eyes are having a harder time converging light rays which are traveling from nearby objects. So basically the converging system or the converging power of the eyes have decreased. So what do we need to do? We need to add a converging lens in front of our eyes in the form of a spectacle, in the form of a glass. And hence that will supplement the converging system of the eyes, and hence we will be able to form images within the retina and hence be able to look at nearby objects. As simple as that. So basically, what do we need? We need converging lens. And what is the converging lens? A convex lens. Convex lens means plus power. Plus power. Okay, done. Now, I said that almost everyone will get presbyopia or will have presbyopia. Most people tend to have presbyopia after they attain 40 years of age. But there is a problem here. What if the patient already is suffering from another optical anomaly in the eye? What does that mean? What if the patient already has spectacles for something else? Let's talk about that. Suppose a patient already has spectacles for myopia. What is myopia? Myopia is basically farsightedness. That means that in this case, the near vision is affected. In presbyopia, near vision is affected, right? But in myopia, far vision is affected. Far vision is affected. And most of the people who actually use glasses, they are suffering from myopia. They are actually suffering from myopia. That is nearsightedness. This is called nearsightedness. Nearsightedness means nearby objects, no problem. Far away objects, problem. Okay. So for far vision, if that is affected, then what kind of a lens will you use? Think about it. If your far away vision is affected, if your near vision was affected, you used convex lens. So if your far vision is affected, you will use a concave lens. You'll use a concave lens because, and we will talk about this when we talk about optics in detail within the ophthalmology section of our channel. We'll talk about this in a lot more detail, myopia, hypermetropia, and all of these optical problems. But for now, just understand this, that in myopia, we use concave lens, that is minus power. But for presbyopia, we use plus power. So if a person is affected by both, then what are they going to do? They are going to use something called a special kind of a spectacle, which is bifocal lens. Bifocal, which means bi means two and focal means focal length. So basically, for both far sighted and near sightedness, we are using two kinds of lenses, or we are using two kinds of glasses, and we are mashing them together. That is what a bifocal lens is. Okay. So for bifocal spectacles, as you can see over here, this over here is the distant and this over here is the far away vision. So there are two zones within the spectacle glasses. One is meant for looking at objects for which are situated far away from a distance, and one for objects which are located closer. That is exactly what a bifocal lens does. Okay. Now, another kind of a lens, another kind of a more advanced lens than bifocal lens is the lens over here. That is a progressive lens or a varifocal lens. So basically, a progressive lens has varying focal length glasses together in an hourglass scenario or in an hourglass configuration. So over in the top, we have a lens which is used for distant objects. In the middle, we have intermediate objects, and in the very low end, we have nearby objects. So basically, in this way, the focal length is decreasing. Okay. So this is varifocal or a progressive lens, and as you can see from this image over here, it is the lenses, they are actually arranged in an hourglass like pattern, like this, as you can see. Okay. Okay. Now another kind of a bifocal lens which used to be used. So in the past tense, now they're not used that much. They're called executive bifocals. So executive bifocals, it's pretty simple. What used to be done previously for treating presbyopia and in a myopic patient is this is like for the far away, and this is like for the near away objects, and there are two different classes, so they're not like these mashed together. They're not as good as these, just like two lenses stuck together for far and near, and that was what used to be used in the past. Now, although we have better bifocal lens and varifocal or progressive lens. So that is how we use or we treat presbyopia. However, what if the patient does not have myopia? If the patient had perfect eyesight and now the patient is suffering from presbyopia, then obviously the patient will not need bifocal lens or varifocal or progressive lens. Then the patient will use what? Just plain monofocal lens. What kind of monofocal lens? Converging, convex, plus power. As simple as that. Done. That was all. Okay. So that's how we treat presbyopia. That was all about presbyopia. Now, the second kind of anomaly of accommodation is something that we say spasm of accommodation. So in presbyopia, accommodation was insufficient. So our eyes had a harder time looking at or rather focusing or converging objects which are closer to us. But what if the eyes are stuck in accommodation mode? Think about this. And this is something that I actually missed talking about when I was talking about accommodation. Basically, this is something that you really need to understand. Our eyes are the most relaxed when we are looking at far away objects. So when we are looking at far away objects, that is when our eyes are relaxed. That is when our eyes are not going through much effort. So our eyes are actually getting rest when we are looking at far away objects. When we are looking at closer objects, our eyes, we put strain on our eyes because that is when the near reflex comes into play. All that convergence, meiosis, accommodation, all of that has to come into play. And so our eyes get strained. That is why we say not to look at computer screens or mobile phones for a long duration because you are putting strain on your eyes. Anyways, but what if this accommodation that happens normally as a part of the near reflex, when you're looking at a nearby object, what if there is a spasm in that? What if the ciliary muscle, what do the ciliary muscles do? I had already mentioned this, the ciliary muscles, they contract. The ciliary muscles contract, and that is what happens when the ciliary zonules need to be relaxed. So the ciliary muscles, by contracting, the ciliary zonules will relax, right? Because you're pushing it, and thus what will happen is the suppose this is the anterior and this is the posterior part. So what will happen is, let me draw this again, contract. So the ciliary muscles are contracting, the ciliary zonules will be relaxed, and the curvature of the lens will be more in the anterior side, and thus this will act as a converging system. Okay, we have already done this. Okay, this is very rough. But what if the ciliary muscles keep contracting even when you're not looking at a nearby object? That is what we say to be spasm of accommodation. So there is a continuous state of accommodation, which means that if there is a continuous state of accommodation, you will have no problem with near vision, with looking at nearby objects, but the far vision is affected. Now, we just talked about a condition where the far vision is affected. What was that? Myopia. Myopia is also another optical anomaly where the far vision is affected. So this is also another optical anomaly, spasm of accommodation, where far vision is affected. That is why this spasm of accommodation is also known as pseudomyopia. Pseudomyopia. So how are we going to treat this? We are going to treat a spasm of accommodation by making the ciliary muscles relax. How do we relax it? We relax the ciliary muscles by using cycloplegic drugs. And how do we understand that there was the near reflex also had meiosis as a part, right? So how do we treat the meiosis? By using a mydriatic. So basically what we are using drugs which are cycloplegic plus mydriatic. Mydriatic means pupil dilators. Pupil dilators, because mydriasis means dilatation of the pupil. Okay, so we are using cycloplegic mydriatics and cycloplegics. Okay, what are they? What are the drugs? Very, very important. Atropine, very, very important drug. Homatropine, very, very important drug. Cyclopentolate, very, very important drug. Okay, so these three drugs, they are cycloplegic as well as mydriatic. Whereas there is another drug which is tropicamide. Tropicamide is only a mydriatic. Only a mydriatic. So only mydriasis. So we don't use tropicamide for treating spasm of accommodation. Rather, we use these three: atropine, homatropine, and cyclopentolate. So that's how we treat spasm of accommodation, and that was another anomaly of accommodation as well as, or rather along with, presbyopia. So with that, I think we have talked about enough as far as accommodation, near reflex, and all of that is concerned. I hope I was able to convey the concepts that were needed in this video, because this video, I think, needed to relay some information as well as some concepts, and I really, really hope, and I'd be really happy if I was able to explain the concepts of accommodation clearly to you. Some part of thinking you also have to do to understand them, and I'm sure you have done that while watching this video. Anyways, we'll continue our discussion on the anatomy of the eye in a later video. This is it for this video. Thank you very, very much if you made it all up to the end. Thank you very much, and I'll see you all again very soon. Thank you.